Avian influenza refers to infection of birds with avian influenza type of viruses. These viruses occur naturally among wild aquatic birds worldwide and can infect domestic poultry and other bird and animal species. Wild aquatic birds can be infected with avian influenza A viruses in their intestines and respiratory tract, but usually do not get sick. However, avian influenza A viruses are very contagious among birds, and some of these viruses can sicken and even kill certain domesticated bird species including chickens, ducks, and turkeys. Infected birds can shed avian influenza A viruses in their saliva, nasal secretions, and feces. Susceptible birds become infected when they have contact with the virus as it is shed by infected birds. They also can become infected through contact with surfaces that are contaminated with virus from infected birds. The potential for low pathogen H5 and H7 viruses to evolve into highly pathogenic viruses. Domesticated birds, chickens, turkeys, etc. may become infected with avian influenza A viruses through direct contact with infected waterfowl or other infected poultry, or through contact with surfaces that have been contaminated with the viruses. Sporadic infections by any subtype of LPAI viruses can occur, but H9N2 LPAI is common in commercial and live-bird market poultry in Asia, the Middle East, and North Africa. Two clinical types of AI occur in poultry: a low pathogenicity, LP, and a highly pathogenic, HP. Infection of poultry with LPAI low pathogenic avian influenza viruses may cause no disease or mild illness and may only cause mild signs, such as ruffled feathers and a drop in egg production, and may not be detected. Infection of poultry with HPAI high pathogenic avian influenza viruses can cause severe disease with high mortality. Both HPAI and LPAI viruses can spread rapidly through flocks of poultry. HPAI virus infection in poultry, such as with HPAI H5 or HPAI H7 viruses, can cause disease that affects multiple internal organs with mortality up to 90% to 100%, often within 48 hours. Some ducks can be infected without any signs of illness. Avian influenza outbreaks are of concern in domesticated birds for several reasons. The potential for low pathogenic H5 and H7 viruses to evolve into highly pathogenic viruses. The potential for rapid spread and significant illness and death among poultry during outbreaks of highly pathogenic avian influenza. The economic impact and trade restrictions from a highly pathogenic avian influenza outbreak. The possibility that avian influenza A viruses could be transmitted to humans. When H5 or H7 avian influenza outbreaks occur in poultry, depopulation, or culling, also called stamping out, infected flocks is usually carried out. In addition, surveillance of flocks that are nearby or linked to the infected flocks, and quarantine of exposed flocks with culling if disease is detected, are the preferred control and eradication methods. What to do if you find a dead bird? State and local agencies have different policies for collecting and testing birds, so check with your state health department, state veterinary diagnostic laboratory, or state wildlife agency for information about reporting dead birds in your area. Wildlife agencies routinely investigate sick or dead bird events if large numbers are impacted. This type of reporting can help with the early detection of illnesses like West Nile virus or avian influenza. If local authorities tell you to simply dispose of the bird's carcass, body, don't handle it with your bare hands. Use gloves or an inverted plastic bag to place the carcass in a garbage bag, which can then be disposed of in your regular trash. All the birds are clinically sound, which are affected die within few minutes to few hours, mortality up to 100%. There may be diarrhea, first white watery or greenish mucoid, at later stage yellowish diarrhea or yellow stained feces, coughing, sneezing, rales and lacrimation from eyes, violet or purple decoloration of comb and wattles and turns blackish after death, mild edema head wattles and comb, liver enlarged and fragile seems to afflict toxicosis, lungs congested, swollen kidney and spleen. Hemorrhage may be found in SC fats, proventriculus and trachea. Conjunctiva are congested and hemorrhagic lesions on the mucous membrane. Crop may contain undigested food particles or gas or water. Profuse cough in trachea and sinuses. Jealous broken eggs may be found in peritoneum. Treating LPAI-affected flocks with broad-spectrum antibiotics to control secondary pathogens and increasing house temperatures may reduce morbidity and mortality. Treatment with antiviral compounds is not approved or recommended. Sulprim-Vet solution. Composition. Each ml solution contains ciprofloxacin and USP 100 mg as hydrochloride. Indication: Sulprim-Vet registered solution is effective against several diseases as CRD, CCRD, mycoplasmosis, salmonellosis, colibacillosis, infectious coryza, pasteurellosis, streptococcosis, staphylococcosis etc. and may be used in viral disease like gumberal, Newcastle disease etc. followed by secondary bacterial infections. Dosage and administration. Treatment: 1 ml per 1 to 2 liter of drinking water for 3 to 5 days. Prevention: 1 ml per 4 to 8 liter of drinking water for 3 days, or as directed by the veterinarian. Erisen-Vet Powder. Composition: each gram powder contains erythromycin thiocyanate INN 180 mg, sulfate BP 150 mg, trimethoprim-BP 30 mg. Indication: Erisen-Vet Powder is generally used to treat infectious coryza, pulmonary disease, fowl typhoid, fowl cholera, cholesepticemia, enteritis, bronchopneumonia, CRD and poultry. Erisen-Vet Powder is specially indicated against the above-mentioned diseases while other antibiotics and chemotherapeutics do not work effectively in cases of resistance problem. Dosage and administration: 0.5 to 1.0 gram per liter of drinking water for 3 to 5 consecutive days. The medicated water should be freshly prepared each day, and the birds must not be allowed any excess water during treatment through the medicated water, or as directed by the registered veterinary physician. Sulprim-Vet Suspension. Composition. Each ml suspension contains sulfatazine BP 400 mg and trimethoprim BP 80 mg. Indication. Sulprim-Vet suspension is used in respiratory, gastrointestinal, urinary and reproductive infections in poultry. It is used for the treatment and prevention of different infections caused by gram-positive bacteria, gram-negative bacteria and mycoplasma in poultry, for example colobacillosis, salmonellosis or pilorum disease, fowl typhoid pasteurellosis or fowl cholera, gastroenteritis, chronic respiratory infection, CRD, and secondary infection of viral diseases. Sulprim-Vet suspension is also used when other antibiotic and chemotherapeutic agents are not effective due to development of resistance. Dosage and administration. Sulprim-Vet suspension should be used daily with drinking water. At first, required dose should be mixed with total quantity of water, which is then mixed with total quantity of water for easy dissolution. Treatment. 1 ml. Suspension with 5 liters of drinking water daily for 4 to 6 days. Prevention. 1 ml suspension with 10 liters of drinking water daily for 2 to 3 days. Andopan Powder. Composition. Each gram powder contains 10% Andrographis paniculata. Indication. Andopan powder is indicated for the prevention and treatment of viral diseases, act as liver tonic, immunomodulator, anti-inflammatory and growth stimulator etc. Dosage. In poultry, use in finished feed as follows. Prevention. 2 mg per kg body weight or 1 gram powder for 50 kg body weight for 5 to 7 days. Treatment. 4 mg per kg body weight or 1 gram powder for 25 kg body weight for 5 to 7 days. Immolyte Liquid. Composition. Glycine, vitamin E, vitamin C, sodium chloride, potassium chloride, sodium citrate, yeast nucleus, amino nitrogen with lactoperoxidase and polysaccharide in a fortified base. Indication. To stimulate cell-mediated immunity, CMI. To improve antibody titer. To reduce vaccine failure. To withstand heat stress. Highlighting points. Enhances the efficacy of antibiotics. Reduces vaccination failures. Improves overall performance. Cuts down the incidence of diseases. Reduces mortality. Reduces the dosage and treatment period. Withstands heat stress. Dosage and administration. Chicks, grower and broiler. 5 ml per 100 birds for 5 to 7 days. Layers, 10 ml per 100 birds for 5 to 7 days. Vita-C 250 liquid. Excellent natural vitamin C composition. Each 100 ml Vita-C liquid contains extracts of Andopan 66.66 ml and hyperlugman 2.64 grams. Indication and uses. Vita-C liquid is indicated for vitamin C deficiency, stress, gastritis, supportive treatment in coccidiosis, diabetes. healing of ulcers, burn, fracture, prevention of gout, development of immunity etc. It is especially valuable in tuberculosis of lungs, respiratory distress, bronchitis etc. It also acts as an antioxidant and prevents aging. Dosage and administration: 2 to 3 milliliters per liter of drinking water, 0.4 milliliters in Vita-C liquid per kg body weight, daily for 3 to 4 consecutive days. Vaccination is one of the most important tools for preventing diseases and in reducing the economic losses of the poultry producers. Vaccination comprises the use of attenuated, killed, or recombinant organisms for stimulation of the body's immune response that recognizes the injected organism as a foreign antigen, resulting in clearing the antigen and developing memory cells in the body. Vaccination is the cheapest, reliable, effective, economical, affordable, and suitable alternate for prevention of diseases in poultry flocks. Avian influenza (I) vaccines have been developed and used to protect poultry and other birds in various countries of the world. Protection is principally mediated by an immune response to the subtype-specific hemagglutinin protein. I vaccines prevent clinical signs of disease, death, drops in egg production, and bird-to-bird contact transmission, as well as decreasing the number of birds infected with AI virus, IV, and reducing high pathogenicity, HIV contamination of eggs and the quantity of AIV shed from the respiratory and alimentary tracts. AI vaccines are produced using various technologies, including inactivated whole AI vaccines, in vitro expressed Asia protein, in vivo expressed Asia protein and vectored systems, and HA-based DNA vaccines to induce protective immunity. AI vaccines must be periodically re-evaluated to determine whether they are still effective against circulating field virus strains, and should be replaced with updated strains if they are no longer protective under field conditions. The vaccines should be given at the age of 10 to 14 days. The vaccine should be stored in cool place less than 20 degrees Celsius. Take required dosage given according or given by registered veterinary physician. Inject medicine at subcutaneous region, near neck or intramuscular region, in breast. 1. Keep your birds indoors at high-risk times. 2. If they can't go indoors, prevent access by wild birds to their food. 3. Proper biosecurity. 4. Cover your run. 5. Make sure coops and other housing are kept clean and dispose dead birds. 6. Limit visitors to your flock. 7. Disinfect property, poultry houses, equipment, visitors and vehicles. 8. Report any suspicions straight away. 9. Follow vaccination schedule and vaccinate all the birds at regular intervals. 10. Maintain records every day and maintain surveillance.